Good evening and welcome to Fact Sheet. Here, if it is not a fact, we do not discuss it. My name is Sefa Dankwa. Tonight, we are talking about the coronavirus pandemic, which is cutting across the globe. And as a result of different variants that have come, government or states have taken steps to reduce the rate of spread within their respective jurisdictions. In Ghana, we've taken numerous steps, and we can go as far back as 2020, somewhere around March, when we announced our first lockdown in the bid to reduce the rate at which the virus spreads within the country. We lifted the lockdown, restrictions were eased in the country. We saw fluctuating numbers of active cases in the country. As we speak now, the active cases of people who have contracted the coronavirus stand somewhere around 700. But as a result of the outbreak, or as a result of the identification of a new variant known as the Omicron variant, countries are now taking stricter measures to reduce the spread of the virus within their countries. And Ghana is of no exception. The Ghana Health Service, about 3-4-5 days ago, came out and stated or mentioned that, for example, if you are a traveler and you are coming into the country and you are not vaccinated, you are likely to be vaccinated at the point of entry. And in this case, I'm talking about the Kotoka International Airport. Others are saying, some are saying that this may be a breach of the rights of travelers who are coming into the country. Some are arguing that these people must give their consent before anything is put into them. After the announcement by the Ghana Health Service, there has been some form of outrage on the part of a cross-section of the Ghanaian populace who are saying that the health rights of Ghanaians must be respected, in the sense that nobody should be coerced under any circumstance to go and take any vaccine, and that the person must agree to visit a vaccination center and take the vaccine. Tonight, we are going to have a conversation around the mandatory vaccination that the Ghana Health Service is proposing as a way of stemming the tide of spread of coronavirus in the country. We will look into the argument that people who are objecting to the mandatory vaccination are proposing. Some are saying that the vaccines cannot entirely be trusted because in other parts of the world, people who have gone in for the vaccines are contracting the virus again, and some are even developing severe conditions as compared to people who have not been vaccinated and have contracted the virus. These are arguments that we will take a critical look into tonight on Fact Sheet. Remember, the show is live on ETV Ghana. It is also live on all of our social media platforms. You can leave your comments on our social media stream, particularly Facebook. Are you for mandatory vaccination or not? If you are for, what arguments are you proposing? If you are against, what are your arguments? Let's hear from you on Facebook as we discuss the matter this evening here. Let me go for a quick break. When we return, two people are going to help me discuss this particular issue. One is a virologist who has been one of the leading voices when it comes to the issue of coronavirus in the country. The other is the chairperson of a group that is objecting the mandatory vaccination in the country. When we return from the break, I shall introduce to you my guest for tonight. Many thanks for staying on with us. This is Fact Sheet live on ETV Ghana. It is also live on ESIM 100.1 FM in Tamale. Also streaming live on Facebook. You can leave your comments on Facebook. But to also let you know that the Ghana Health Service or the government of Ghana has indicated that an airline that brings in any individual who is unvaccinated will be sanctioned per person $3,500 as a means of deterring people who might not necessarily be vaccinated within their countries of origin before arriving in the country. Let's start the conversation in-house and begin with Mr. Adam Senanu, who is the chairperson for the Advocates for Christ Ghana. They held a press conference today. They had something to say about mandatory vaccination in the country to also help us understand why there seems to be some misconception surrounding the fact that people have gone in for the vaccines and yet still they are being reinfected by the virus. A virologist at the KCCR in Kumasi will help us do that. Dr. Michael Owusu, who has been a leading voice in this particular matter, especially when the pandemic started somewhere around February 2020. Welcome, Mr. Senanu.
Thank you for having me.
It's a pleasure having you tonight, and I believe that you've been busy today, running from one channel to the other. Let's begin the conversation with, will I be wrong if I say that whatever it is that you are doing in Ghana here seems to be an offshoot of what has started in some parts of the United States of America, where some Christian groups are saying that we are going to resist any coercion to go and take any vaccination?
Interestingly, I have not paid attention to that. And really, this has not been from a faith perspective. It's purely from the science of it.
Okay.
So Advocates for Christ is actually a great movement of professionals. And we typically do a kind of think tank approach. You research what the issues are, look at all the data we have, then based on the data, take an informed position. So it's our look at what is happening in Israel, in Ireland, in the UK, in Australia, and what is happening in Africa, and drawing conclusions from the last 18 to 24 months and saying that, but Africa has done much better than these other jurisdictions where they've been promoting vaccines. So there's kind of an incongruity, inconsistency, that those who've been pushing and chasing the vaccines, and a lot of turbulence. Israel, that has been the forerunner, #1 country, has finished with the 2 jabs, booster 1, booster 2, booster 3, and there's turbulence. There's a lot of problems there. So we are wondering whether we are thinking through the science right. Those of us who
do you feel that we've not gotten the science right with regards to our quest to ensure that there is mandatory vaccination?
Yes, it seems as if vaccines is not the answer. It looks like it's one of the answers, but it probably is more effective for some categories of the population than most, and not something that is working for every place, So we've done very well without the vaccines. We've used therapeutics over the last 18-22 months, and we've seen that we've had 99% recovery, 1% mortality, basically from underlying conditions. It suggests that those with underlying conditions are the people we should be focusing on to strengthen them as well. So there are disparities between what the data globally and locally is saying and the position we have taken currently, and that's why we decided to speak.
You mentioned that if you're comparing jurisdictions like Europe and that of some part of Middle East and that of Africa, Africa seems to be performing well. What do you mean by saying that Africa seems to be performing well? In what sense?
So we're looking specifically at what is the level of infection you are seeing, what is the level of recovery you are seeing, what is the level of mortality. So 3 key indicators. How many new infections, how is it rolling? And out of those infections, reported positive cases, how many of them are able to recover and be discharged? And on the other hand, how many of that end up being dead? And if you compare Israel, which is the #1 country with over 90%, we're targeting in most places 80%, said it will get you through herd immunity.
Yeah.
Now, Israel, Ireland, and countries like that are 90% plus. but they all have turbulence. They found that the vaccinated are rather getting reinfected. They found that after 2 jabs, they now need boosters. So if you think through it, it appears that the vaccines are not protecting the individuals against reinfection of the same. The vaccines are not being effective against new mutants and variants. And the countries that have pursued the large population coverage appear to be having more health turbulence than was expected when they said, oh, vaccines will solve it. However, in contrast, continents like ours where we didn't have the vaccines by default, it wasn't because we didn't want it. We wanted it, but they didn't bring it. We've seen higher levels of recovery, lower levels of mortality. And if you go around now, 80% of your people are comfortable doing their work, not even thinking about it. So there's a certain disconnect where, because of the lack of adequate public education, people don't see where the crisis is. What is the current crisis for which we are saying be compulsory vaccinated? And how much education have we done for people to arrive at that conclusion? Especially when you have people who are aware. Who
is supposed to do the education?
Or is the state?
The state is supposed to do the education. The state, at the same time, is saying that, okay, look, go for the vaccination.
And they are
do you think it is? Do you feel it's deliberate on the part of the state to not to do proper education, but to, in a way, subliminally coerce people to go and take the vaccine?
I think that there's been poor planning in terms of the public education. All of a sudden, at the end of November, you're being told you have 1 month, because by January, if you have not been vaccinated, teachers, doctors in public health institutions, children already been vaccinated compulsorily. I mean, whether they like it or not, if you're in a public institution, you know. There's a sudden rush, which is terrifying. And there are people who have genuine medical conditions. Like, there's a lady who was, this morning I was talking to someone who has a blood clot condition where she easily gets blood clots. So she's been worried about taking any vaccine. She's working in the UK. Her GP has been trying to carry, said, no, I think it's a death sentence. I'd rather resign because the deadline is 24th December for the UK. And so she was saying she's coming back to Ghana. Then Ghana says, so now double jeopardy.
You cannot come back to Ghana without being vaccinated. Is that you're forcibly vaccinated at the point of entry, or you go back?
I'm telling you. So she has a problem. So I was talking to the people who said no, but the UK sometimes gives exemptions. So she should fight for that. So it's not easy. She feels like it's a death sentence. And I know one lady who lost her only son. She's been crying because they went, he took it, had headaches, 2 days, gone. So now she sold most of her property, says she's out. She wants to come back. But the pain, you know, so we are not even capturing the adverse effects and reactions so that people know that this thing is not just as simple as that. There are people who have suffered because of this. So we are saying it is not, don't just say compulsory by force, because people have issues and they're genuine. And the data globally is showing that if you take the CDC, US Central Disease Control Site, it shows that in the US alone they've had 10,000 mortalities as a result of COVID-19 vaccines. That's a very large number. Under normal circumstances, that's not. It's almost as if we are saying that these lives don't matter, but that's serious. So let's not take it lightly. We think that government should tread cautiously. If this is what they wanted to do, the education should have started long ago and should try and get people to the point where everybody feels comfortable. We've all looked at the data. Another thing they've not done well is to provide the data justifying why all of a sudden they're saying, they only say, oh, Omicron has more mutations, therefore. But where's the Omicron?
The Ghana Health Service today gave an update saying that 4 more Omicron variants have been found within the community.
The one that is the mild headache of Omicron is giving us severe headaches this Christmas. Because people are wondering what will happen to them in January. When the teachers who are worried about vaccination, the doctors who are worried about vaccination, I mean, you should get some of the professionals. Just do some tinkering around. It's not the ones who are talking, not the public health experts who are hey. Not those who've received the 71 million euro, according to the CNN travel guide. As of today, CNN has made a travel announcement that the government of Ghana has received 71 million euro for pandemic response.
Yes.
I mean, seriously.
Adam, I'll come back to you, but let's go to the phone lines and speak to Dr. Michael Owusu, who is a virologist at the KCCR. He's been speaking about this pandemic since it came into the country. Doc, good evening. Many thanks for joining us.
Good evening.
Doc, if you can hear me, good evening.
Yeah, good evening. I can hear you.
Thank you very much. I trust you're doing good.
I'm doing well.
Doc, let's understand this. What seems to be the issue with people going to taking the injection and later on being reinfected by the virus? Is it that the vaccines that we're taking in are not as potent as we claim to be? We claim it to be.
Yeah. So, if you have studied about vaccines and then the effect of vaccines on viruses, bacteria, microbial pathogens, you come to understand that the purpose of vaccine is to prevent various forms of levels of disease. One, it could prevent infection. Two, it could prevent developing moderate to severe disease as a result of infection. Or three, it could prevent death as a result of infection from disease. In order to understand this, whenever vaccines are produced, it has to go through a phase of clinical trial. So you have phase 1, phase 2, phase 3, and then 4A, phase 4, in order to be able to assess what you call the efficacy of the vaccine. The efficacy of vaccine is determined from two main populations. One, a population that receives the vaccine, and then a population that does not receive the vaccine, or what we call a placebo. And then you measure the outcome of severe disease, deaths, or possible moderate to mild illness, in both arms, and then you can weigh it. And this is what has been done for the vaccine that we are currently using. So if you look on the labels and they say that AstraZeneca has 70% efficacy, what it means is that if somebody was vaccinated, with AstraZeneca vaccine, the person has about 70% level of protection, higher or compared to somebody who has not taken the vaccine. So a lot of the vaccines that we are using now, the endpoint for measurement was severe disease and deaths, not asymptomatic illness. Few data is coming up from asymptomatic illness. So it's quite clear that if you take almost all the vaccines, it has high potential of preventing people from getting severe disease and then dying. And this data came as a result of comparing a group of people who have not taken the vaccine and then another group of people who have taken the vaccine within the same population. It's based on this confidence, with which the world is moving towards promoting vaccines and generalizing vaccines and making it more somehow advocating for people to take it so that we'll be able to at least reduce severe disease and possible death that may come as a result of becoming infected with this. So this is the principle that underpins a lot of vaccines that have come in the world from several years till now, and it hasn't changed. So I'm not too sure why we seem to have a problem now. But if you take the vaccines we are taking, hepatitis B vaccines, yellow fever, measles, and all the vaccines that we give to children, they have gone through series of phase trial from level 1 to level 4 before they were generalized to the entire population. And because the benefit
Doc, I would want to come in there.
The risk.
I would want to come in there. So how long normally or usually does it take for the production of a vaccine to go through the different phases? For example, you mentioned from level 1 to level 4. How long normally or usually does it take?
Yeah, so before COVID, a normal vaccine from phase 1, from the preclinical phase to phase 1 to phase 4 could take 10, 15 to 20 years. This is normal that we used to know. But this was based on the technology that was used some time back in developing those vaccines. But with the advances in science, you've heard about messenger RNA technology. New advances have come that have shortened the duration now for producing vaccines, which has cut down the number of years, some 6 months, 1 year, 2 years, some within a few weeks. You are able to generate raw material that enables you to do this. So the advances in knowledge have shortened this period, which is why we are seeing COVID vaccines being produced, receiving emergency authorization, and getting this use. So
has
for now,
shortage...
phase 1, 2, and 3 can be done quickly. I mean, within a short time than what we used to do before.
Has shortening the time in any way had any impact on the efficacy of the vaccines that have been produced?
Well, the phase 1, I mean, the phase 3, the phase 4 trial, which is conducted on masses of people in thousands and sometimes up to hundreds of thousands. Mm-hmm. This phase is the phase within which you gather data to be able to know whether a vaccine performs or not within people that are willing to enroll in a trial. And for all the vaccines that are out for now, I mean, for all the trials that have been conducted and published, the data clearly shows that these vaccines have high level of efficacy, which is why the WHO has adopted them and made it more advocacy for countries to use. And many countries have given emergency authorization for their use. So we have enough evidence to show that it works, and the benefits far outweigh the risk. Which is why we think
the reality that we are currently experiencing, because you're making mention of the fact that we have data, we have evidence that it works, is the reality that we are currently facing or experiencing back that particular data that you had, that the vaccines are efficacious enough to deal with the coronavirus pandemic?
Of course. I mean, that's why I say that if you, from what I say, I keep saying that the benefits outweigh the risk. If you study medicine, and there are terms that we use, we have principle of beneficence and principle of non-maleficence. So a drug or a care should have benefit the population and not harm. So if you weigh two populations and your intervention is likely to benefit the group that is receiving that intervention, you are better off in promoting the use of that than withdrawing it and observing or seeing the people suffer and eventually die. So what happens with COVID is that the COVID has about 30,000 blocks, what we call nucleotides. And it's one of the longest RNA viruses that you can find. Mm. And almost every 2 to 3 months, 1 or 2 nucleotides could be knocked out and be replaced. And this could result in a change of what we call the amino acid blocks in the virus. So we have known this since the 1970s, when you have the different strains of coronavirus come up. And we have about different types of about 6 strains which are in the system. OC43, 229E, NS63, HKU1, MERS corona, SARS-CoV-2-1, and now we have SARS-CoV-2-2. All of them have come as a result of changes in blocks of the virus. So this particular one which we have is going to go through this phase for several years to come. It's not stopping now because of the nature of the virus. It's very long and has a potential to replace itself with that mindset of becoming much stronger and surviving within the population. That is the mindset that the viruses have. How do they survive? They survive by adapting themselves to the population. If they have to change everything and be adapted, they will do. But the thing about vaccines is that, which is what we have observed about these variants, is that if maybe a particular vaccine has 100% level of protection, and a variant comes in, the variant is able to reduce the level of neutralizing antibodies by 10 or 20%, and some even go to about 30%, which will mean that it doesn't mean you have zero level of protection, but your protection level will be reduced or cut down by about 10 to 20%. In that case, you could go back to get your 100% by taking a booster dose. It's the same thing
Would
that
that
works with the
mean
influ.
would that mean that, for example, every time that you're being reinfected, you may need to go in for a booster shot? For example, I've already taken my Pfizer 2 doses. I get reinfected, and I'm told to go for a booster shot. Then after the booster shot, I get reinfected again. Then I might be told to go in for another booster shot. Then it means that taking the vaccine is not going to be a one-off thing. It's going to be continuous over a period of time. Would that not have any impact on the biology of the person who is consistently being vaccinated?
There's a difference between a booster dose and becoming reinfected. You don't take a booster dose because you have become infected. There are two different things. If you take a vaccine, you can still be infected by the virus. But the point is that you are not likely to suffer severe disease or death compared to somebody who has not taken the vaccine. This is at the population level. So that is how it works. Booster dose, whether you are infected or not, you know that after 6 months, the level of immunity continues to way down. And because of variants, that protection level may still go down. How do you keep your system strong to be able to resist against becoming infected or possibly not break or dying when even you are infected? It is by keeping your immunity level at a certain threshold, which is why these booster doses become important. For instance, in the US, they give annual influenza vaccines because of changes in the mutations of influenza viruses. Because every year you have influenza occurring as a seasonal virus within certain times during their winter. So they give you this booster, and it runs throughout the year, and it's been doing that for several years now. And this is how SARS-CoV-2 is likely to be. Anytime it goes through these changes, immunity begins to wane, becomes reduced. So to keep your threshold at a certain level so that in case even you are infected, you don't suffer severe disease, you have to go for it. So it's something that it happens, and we just have to understand and then see how best to adapt to it.
Doc, I'll get back to you and ask a question around the data that has been gathered so far in this country, the vaccination. I don't know whether you've had reports of people reacting to the vaccines that they've taken, but in other parts of the world, we've heard of people having reactions and even some leading to other sorts of other types of infections and even leading to death. But let me come back to the studio. Adam, you heard Doc explaining. So it means that, for example, since influenza outbreak came and we were able to develop a vaccine for it, once a year you go for a booster shot because your immunity against influenza might have gone down or might have waned over the period that you did not take the vaccine. It looks like COVID-19 is going to be same. And it looks like, whether we like it or not, people at a point in time are going to be forced to take the vaccine.
Well, it's all very confusing. Look, 90% of Ghanaians have not had to do any vaccines. Now they are trying to ramp up, get into it. We've not had to do any vaccines, not done any boosters. We are fine. Okay, natural immunity has allowed us to survive this far on probably the more deadly mutants to date. They say Omicron has more mutations, therefore, But I think the scientists are going to have to do a lot more work to convince us that they are getting it right. Because it's a bit...
As it stands now, you feel the scientists are not doing...
And by the way, I'm a scientist myself. I started as a scientist, research scientist, So I'm looking at the data globally and locally and telling myself, these guys, I'm not sure they got it right. And I have a feeling that right from the trials, what he was talking about, it's because we've not done all the trials and tested and understood. We're assuming that the various pharmaceuticals are giving us all the proper data, the raw data. But if you look at the information filtering through from the US, there are lots of people who feel like the right processes were not followed, and they are not very certain that the approvals have been properly gained. So it's not surprising that the results we are getting appear to be very mixed and confused. The countries that have gone ahead of us and have pushed this seriously seem to have more problems today than when they started. So you're wondering, is this really the way to go? So I'm not certain, and I'm a scientist.
Based on the data?
Based on the data.
You're not convinced?
I'm not convinced that I mean, take Ghana. Just take Ghana. The majority, 80 to 90% of Ghanaians have survived to today without vaccines and without boosters. What did our doctors do? To the large part, it was either erythromycin, vitamin C, vitamin D, ivermectin, vitamin C, vitamin D, or hydroxychloroquine, you know. There appears to be a need to interrogate what we have done locally in Ghana and probably in Africa to understand why it is. I mean, yes, we have the geographical issues of temperate zone versus a tropical zone, the temperatures, and therefore probably the viruses are not more susceptible or more virulent within the colder, cooler areas, which is true. But honestly speaking, where is that crisis locally? And yes, the public health experts say that they want to prevent us against the future. But protect us against the future using vaccines that have been tried and tested, that we are not seeing such large side effects in terms of the global reportage. And this reportage, you see it on the CDC website of the US itself. Yeah. We are not taking it from some, what do you call it, fake sites. No, CDC itself is reporting that this is what's happening. UK government site is reporting I have all these heart conditions. And local people, we have people who we know, friends, whose fathers have passed. 2 days after, they were fine. Several years, take this, they are dead. So what are we talking about? I mean, I think that that's why we must make haste slowly. I've heard some of the lawyers, like, I've forgotten his name, who is both a doctor and a lawyer, talking about how Articles 12 and 14 provide a basis for this. But I think they're not thinking through it very clearly. The question of who is a threat or infringes on the right of another person is not whether the person is vaccinated or unvaccinated. It's whether the person is infected and is able to transmit. So you cannot, on the basis of because you are unvaccinated, therefore you're infringing on my right. That's where they've been arguing from. But if you look technically at Article 12 or Article 14, Article 14 then does exemptions. It says that, look, your personal liberties can be restricted, especially if you have an infectious or contagious disease. It is clear, infectious or contagious disease. It does not say whether you are vaccinated or unvaccinated. And there's a certain assumption where people are beginning to associate unvaccinated with, therefore, you are infected and you are a threat to me. But that's not it. In science, it's about the infection. So on that basis, they've now done compulsory mandates that if you're unvaccinated, it's like unvaccinated automatically means that you are a threat to us.
So the premise is wrong.
It's wrong. It's wrong. And that is why we are saying government should slow down. We are for all the COVID protocols. Let's continue. Masks, wash hands, social distances. We are even for vaccination, but we are saying let's think through the data some more and be cautious. And let's not just rush into it, because what they are quoting from Article 12 and Article 14 doesn't support what they are doing. Indeed, they are infringing on 12, 13, 14, and 15 on the rights of citizens now. From yesterday night, this morning, a lady was sitting to me whose son arrived from the US. They were contemplating, because of the mandate, whether he should come out at all. They said, okay, you come and see whether you can refuse. He ended up having to be part of the 100 who were jabbed. This morning, he couldn't get up. They say his arm can't. So the parents are running around trying to find, what do they do?
And in that case, do they have,
They're not, but they've left the airport.
I know, but if your rights have been infringed upon, what do you do?
It's too late, and that's the thing. These guys have indemnified themselves. They've been indemnified. Both Big Pharma and government have been indemnified. So who do you go and report to?
Adam, let me put this question to Dr. Michael Owusu. Doc, what do you make of government's mandatory vaccination? That, for example, if you are an unvaccinated traveler coming into the country, you are forcefully going to be vaccinated. Do you feel that is the right way for us to go?
Yeah, so for me, I keep saying that every country has their own policies of what they want to do to prevent active transmission of viruses that are considered to be public health emergencies of international concern. you know that when this virus came in, that this is the tag that the WHO gave to this particular virus, that it is associated with a public health emergency, and therefore all countries are supposed to step up some measures to reduce possible transmission and, if possible, prevent deaths as much as they can. So, the Omicron, most of the data from South Africa seem to show that those who have been heavily infected are young populations who are in their 20s to 30s and who are unvaccinated. So the idea is that those who are unvaccinated have a higher chance of driving the infection compared to those who are vaccinated. It doesn't mean vaccinated cannot be infected, but the number of vaccinated people who are infected and can transmit, the numbers are much lesser than those who are not vaccinated. So it suggests that one of the ways you can reduce and cut down on transmission to enable you manage the pandemic in your country is putting in measures like this. And the measure will not stop the virus from coming. You can't prevent the virus, but then you can reduce the numbers to give you some leverage to be able to control, to manage, and then get your health systems running. I mean, COVID ideally should not be a problem like flu, that you can have it and go along your duties. But because many people can be infected within a short space of time and then get the health sector overwhelmed and lock out health workers and have high demand for oxygen and making things more difficult. This is why some of these measures are important, so that you can reduce the numbers and then at least give yourself some breathing space to manage the few people who will get illness, and then you go along and manage things as they are. Instead of waiting and allowing influx of huge numbers that will likely drive the infection to the highest peak level, to the point where you'll be begging for oxygen. The idea is, why don't you put in some levels, some measures to ensure that at least you.
But you keep on saying that the unvaccinated. However, we've not been identified as to whether these people who we claim to be unvaccinated actually do have the virus.
What I'm saying is that data from South Africa, from those who were infected with the Omicron, 60 to 70% of them are those who were unvaccinated and are between the ages of 20 and 30. So it seems to suggest that unvaccinated people have a higher chance of driving transmission compared to those who are vaccinated.
Okay. Doc, thank you very much for joining us this evening on Fact Sheet.
You're welcome.
Let's go for a quick break. When we return, the final question will be, what do we do if we are to hasten slowly, as suggested by Adam? And if we are actually going to hasten slowly against vaccination, how do we help in reducing the rate of spread in the country? That's the final question that I would ask Sedem when we return from the break. This is Fact Sheet live on ETV Ghana, live on Nisim 100.1 FM in Tamale, also live on Facebook right now, streaming live. Are you against or for mandatory vaccination? Final question. We have been notified that we have just about a minute or two to wrap up. If we are to hasten slowly towards mandatory vaccination, what do we do? Because it looks like the daily record of infection seems to be increasing after, we announced globally that there has been a new variant, the Omicron variant.
Well, I don't think we are talking about hasting slowly. We are just saying government should tread cautiously and continue with your vaccination, continue with all the protocols, increase education.
Okay.
I've heard some of them say they've done a lot of education, but I haven't heard, I haven't seen. And usually I do a lot of field work. When I go into the field, talk to anybody who is in the rural areas working. they don't even understand what we are talking about. And so to assume that in 1 month you can cover 80% of the Ghanaian population with vaccines, I mean, I'm just wondering which kind of special skills we have.
Are you optimistic that could be done?
Oh, it's not going to happen. It's just not going to happen. And it's not about threatening us either, because if you don't know, it can be a pushback. I think that government should continue increasing the education so that people understand. If, for example, the South Africa data shows that there is a category of the population who become high risk and therefore they want to, let that explanation count. Let them show the data. See, we are very intelligent. As long as there's data backing and it's being explained, people now have confidence. As long as there's data backing the vaccines they are using and why this type and not that type and the options, and people can say, I feel safer with this, you get the result. But don't stampede the Ghanaian population into mandatory vaccinations. That will not augur well for government or for the citizens.
Many thanks, Adam Senano, who is the chairperson of the Advocates for Christ Ghana, who joined me in the studio tonight to discuss this all-important issue. The show will be repeated tomorrow at 10 a.m. My name is Sefa Dankwa. Up next is at 11 a.m. rather. It's going to be repeated at 11 a.m. in the morning. My name is Sefa Dankwa. Up next is Girls Vibe with Ekumfi Princess. And have a good night.